So, good day, fellow delegates to this year's conference. My name is Mathew Okoh, and I am presenting on the seasonal variation in the prevalence of post-abortion care, post-abortion complication in northern Nigeria. Specifically, this data was collected in Kano State. So the interest in this topic was the fact that you have both programmatic and policy implications, in that if there are relationship between the number of cases seen and the seasons in which these cases present, then resources can be made available to effectively attend to those cases at those times of the year, and potentially interventions to look at what may be responsible for the clustering of post-abortion complications at certain times of the year. So the summary here from the study was the fact that the data that was available did not indicate any seasonal variation in the presentation of post-abortion cases in Kano State, Nigeria. However, despite this absence of seasonal variation, data indicates need for the provision of adequate resources for the management of these cases when they do present. So, although available evidence suggests that there are developmental abnormalities contribute to early pregnancy loss, evidence of seasonal variation in the prevalence of miscarriage could suggest the presence of other factors that could be modified to reduce the occurrence of early pregnancy loss. Because given the result of this finding, there might be need to conduct further studies in order to arrive at a more conclusive results concerning this phenomenon in Kano State, Nigeria. So different researchers have linked spontaneous abortion or miscarriage, as it is referred to in some quarters, to certain times of the year. For example, McDonald in 1991, from a facility-based study, 7 facilities in Montreal, Canada, identified that there was clustering of spontaneous abortion in the spring months. The same thing was found out in Hungary, following a population-based study. It was actually a 10-year retrospective review that led to this finding in Hungary. Again, in the United States, a prospective study of about 300 women who were actively seeking to become pregnant, was found that pregnancy loss was more common between the months of September and December. So this led to the belief that there could be some evidence of clustering of spontaneous pregnancy loss in certain times during the year. However, although the literature is very limited in this subject area, they were all done in Western countries with no evidence of this type of study being done in Africa as a whole and Nigeria in particular. So, like I had mentioned earlier, it could be helpful to look at what are those, if this phenomenon that has been identified in other countries is present in Nigeria as well, then there might be need to design, implement interventions that could influence the management or prevention of this spontaneous pregnancy loss from occurring in Nigeria. So this was a retrospective review of hospital records from 30 health facilities in Kano State, Nigeria. Remember, Kano State is one of the northern states in Nigeria with 44 local government areas. So these hospitals that were included in this study were hospitals that were part of a post-abortion care intervention program that was conducted by an NGO here in Nigeria. So more than 93% of these facilities were secondary level facilities and 90% of them, about 27 of those facilities, were public sector health facilities where post-abortion care cases are managed in Kano State. So the data was reviewed over a period of 3 years, beginning from October 2011 to September 2014. And so the review period was broken down into two, since the intention was to study seasonal variation. So we looked at a number of cases during the rainy season and during the dry season, and we also split the data by quarter, because we have January, February, and March, April, May, and June, July, August, September, October, November, and December, forming the 4 different quarters of each year. So the student t-test and Kuskawalis is a non-parametric equivalent of a t-test, was used to examine differences in the mean number of women who presented for post-abortion care treatment in these facilities. So over 14,000 women were seen in the period under review, that's between October 2011 to September 2014. And in each of the year, roughly 3,000 was seen in the first year, 3,056 actually, and 5,508 women were seen in the second year, and 5,453 women, totaling 14,072 women were seen in the 3-year under review. And statistical analysis did not show any significant difference in the number of women who presented in each of the different time periods that were examined. In other words, between rainy season and dry season, there was no difference in the mean number of women who presented for post-abortion care management. Also by quarter, there was also no difference, as you can see from the test results that has been presented. So the box plot analysis indicated significant variation in the number of cases within each year and across the month. As you can see from the box plot, the median value was way higher up, with most of the other cases clustered in the downwards area. This was the number of women treated in each year, and then the next plot shows the number of women who were seen by quarter. And you can see the significant variation in the numbers across each quarter. Of course, again, we know that abortion cases are not normally a distributed phenomenon, so that could be responsible for this difference in the way the numbers are presented. So again, we also looked at the number of women who were seen in each month of the year, and as you can see from the line graph, there was no specific pattern to the way these cases presented in the hospitals. So in conclusion, although it appears that more women sought treatment for post-abortion care during the rainy season overall, results from statistical tests were not consistent. There is a need, however, to make sure that there's resources available, both human, material, and otherwise, or supplies, to be able to attend to women who seek post-abortion care treatment in Kano State, Nigeria, irrespective of the season of the year. So, given this inconsistent result that we have seen, there is need to further studies to be conducted in this area in Nigeria in order to conclusively determine if there is any seasonal variation in the way spontaneous early pregnancy loss happens in Nigeria compared to what has been documented in other countries of the world. Thank you.